So Grant asks, what are we going to be looking at to decide whether or not we should be tightening or loosening restrictions? And again, folks, it all goes back to preserving the healthcare system. You know, a lot has been made about talking about the number of cases and so forth, but as we test more, we're going to get more cases. And as we test different populations, that also changes that variable. So that's really, it's a good leading indicator in some places that you might have an issue for your healthcare system. And so, for example, we used that in Dawson County with Lexington when we saw that the number of cases we're testing there were reaching 30% or more. We said, okay, we better start moving people out of that hospital to make sure that it isn't overwhelmed, and we've successfully done that, right? The hospital there is stable, it's handling patients, we've moved people when we needed to. So that's kind of what we use it for, but as you test different populations and you change how you're testing people and you've got more tests coming online with Test Nebraska, you're changing that variable. So it's not a real good, consistent indicator. But again, the whole goal of what we're doing is about the healthcare system. So we monitor very closely what is going on with regard to our hospital beds, our intensive care unit beds, and the ventilators. So that is what we will be using for all these decisions. If we can start loosening these restrictions and keep the healthcare system preserved and stable, then we know that we can take more steps. If we start seeing that we're at risk of having that healthcare system not be able to provide that hospital bed, then we will look at tightening those restrictions. So it really gets back to what are we doing with regard to how we're preserving the healthcare system.